Hello, I'm Dr. Beena Muktesh, Clinical Director, Silverleaf Fertility. There are certain fears in the mind of the couple when they go for an IVF treatment. I thought it is very important to discuss and address these fears. The most important fear which the couple has is, will eggs and sperm be ours? Of course, the sperm and eggs is going to be yours only. The eggs are collected from the ovaries of a female. They are mixed with the sperm collected in a container from the male partner. They are mixed in a high-tech laboratory, fertilized. When the embryos are formed, these embryos are placed in the uterus of the female. So, genetically the baby is going to be yours only. Another fear which they have in mind is, once IVF, always IVF. They think if once the IVF has been done, every time if they want to conceive, they are going to have IVF only, which is not true. There are many patients who conceive naturally after having one IVF cycle. The reason being, the ovaries get stimulated in IVF and they restore their function and start producing eggs. So, such patients can conceive naturally also after IVF treatment. Another fear in their mind is, will it give 100% success, or is there 100% guarantee that patient is going to conceive after IVF treatment? With the high technology and latest improvement in the treatment of IVF, the success rate of IVF has gone up, but still there is no guarantee. So it should be very clear that whenever you go for an IVF, there may be some failures. Second cycle or third cycle may again give pregnancy. So it's always better to have in mind that at least I might have to go for 2 or 3 cycles as well. If the patient will be on bed rest for 9 months, no, it is not necessary. Patient can go to the office, they can restore their normal activities at home and office, they can take a walk, they can perform all the duties whatever they were doing before. Only thing they have to keep in mind is that they should not exert themselves and feel mentally relaxed after having an IVF, so they get a better results. Most of the patients, they think that there are many complications in the IVF. Let me tell you, nowadays there is a lot of improvement in the treatment of IVF with the latest technology and the injections which are given subcutaneously. Patient doesn't have much pain. These injections are very small injections which are given to stimulate the ovaries. They are just like insulin injection which are given subcutaneously. Another thing they want to know is, if I take a treatment of IVF, am I going to deliver the baby by cesarean only? That's not true. The cesareans are performed only if mother's or child's health is at risk. Otherwise, no need for any cesarean, just because they had IVF pregnancy. Most of the time people have a fear in their mind, am I going to have twins if I have IVF? Because they think that I just need one baby. But are they going to be twins? That's also not true. If we are transferring only one embryo, then there is going to be one pregnancy only. But even if we are transferring more than one embryo, suppose we are transferring 2 embryos, still the chances of twins is only 10%. So it is not necessary that all the patients undergoing IVF treatment are going to have twins or multiple pregnancies. Another fear they have in their mind is IVF a painful condition? Nowadays, subcutaneous injections for stimulation of the ovaries have come. As I told you before, they are just like small needle injections, just like insulin injections, which are given subcutaneously for 9 to 10 days. So there is not much pain because of the injections. Egg collections are done under anesthesia. 10 minutes anesthesia is given and the eggs are collected. So there is no chance that they are going to have pain. So don't be scared that IVF is a very painful condition. Most of the time, people who have to go to the office ask me, for the whole process of IVF, will I need to have 15 days holidays, or will I have to take an off from the office for 15 days? No, that's not true. Only on the day of egg collection you have to take off, or on the day of embryo transfer. Rest all days you can go to the office and perform your normal duties. These injections which are given to stimulate the ovaries can be given in the morning before going to the office, and even the blood sample can be done at the same time. Patients usually ask me, will I be able to work in the office if I am pregnant with the help of IVF? The answer is yes, of course. You will be able to take the complete responsibilities in the office and perform all your duties, because IVF is a daycare procedure. There is no need for admission, there is no cut, there is no stitch removal, no opening of anything, any cavity. Another thing which most of the people ask me, will my baby be normal? Yes, all these babies who are born by IVF are normal. The congenital abnormalities of babies are similar to congenital abnormalities if they would have conceived normally. Many studies have shown that there is no increase in the number of abnormal babies as compared to normal pregnancies. So I am sure you must be clear in your mind and must have clarified all the myths about IVF. Thank you very much.